You know when you go to a doctor's appointment and you just kind of wonder what's really going on behind the scenes? Well, today, we're pulling back that curtain on modern prenatal care. We're going to explore the really critical decisions and screenings that shape a healthy pregnancy, all the way from the first trimester to the third. Let's dive in.
Right? You go to the appointments, you get all these tests, but what's the actual game plan behind it all? It's so much more than just checking boxes. It's really this dynamic system of prevention and proactive care. So let's break down how it all really works.
Okay, so we're going to start right at the beginning, the first trimester. You know, these early weeks are absolutely crucial. It's all about setting a solid, healthy foundation by screening for potential issues long before they even have a chance to become a real problem. Check this out. You can see a big difference here between what's considered a routine screening and what's a selective one. So, for example, let's say we have a 28-year-old in her first pregnancy. She is always going to be screened for rubella immunity. That's just standard. But what about tests for things like CMV or chickenpox? Well, those are only done if a specific red flag pops up, like if she's showing symptoms or if there's a reason to believe she's not immune.
So, why all the intense focus on rubella? What's the big deal? Well, it all comes down to one thing: congenital rubella syndrome. See, if an expectant mother who isn't immune gets infected, the consequences for her baby can be just devastating. This one simple, totally routine blood test prevents a world of potential harm, and it's a perfect illustration of just how powerful proactive screening is.
But not all screening is a one-size-fits-all kind of deal. From here, the focus really starts to shift. It becomes all about how care is tailored to an individual's specific risk factors. This is where prenatal care gets really personalized.
Let's look at a new scenario. We have a 34-year-old, and a key piece of information here is her body mass index, or BMI, which is 32. From her very first visit, this single number acts like a little flag, telling the care team exactly where they need to focus their attention to help prevent complications down the road.
So here's the crucial link. A high BMI is one of the strongest predictors for developing something called gestational diabetes mellitus, or GDM. And you might ask why? It's because the underlying adiposity, which is really just the amount of body fat, can cause the body to become resistant to insulin. This is exactly why women with a BMI of 30 or higher are screened for GDM early, and then they're checked again later in the pregnancy.
And the risks don't just stop there. A higher BMI, along with a few other things, also raises the risk for pre-eclampsia. Now, that's a really serious blood pressure disorder that is a leading cause of problems for mothers and infants all over the world. But here again, there's a proactive measure that doctors can take.
For patients who are identified as being high risk, the solution is surprisingly simple: a low-dose aspirin. The way it works is it actually improves blood flow to the placenta. This small, daily intervention has been shown to significantly reduce the risk of developing preeclampsia and its complications. It's just a perfect example of targeted, early risk management in action.
Okay, now let's fast forward to the third trimester. At this point in the pregnancy, the focus often shifts from prevention to more active management and intervention, as new challenges can, and often do, arise.
So picture this: a 25-year-old woman. She's very late in her pregnancy at 36 weeks, and she suddenly shows up with some very specific symptoms that immediately set off some alarm bells. She's experiencing this incredible thirst, and she's going to the bathroom all the time. A quick check of her blood sugar reveals a random glucose level of 200. Now, when you have these classic symptoms combined with a blood glucose reading that high, the diagnosis is pretty clear.
And here's the crucial part: there is no time for more testing, like a formal glucose tolerance test. The situation is just too urgent. The most direct and protective next step is to begin insulin therapy right away, to get her blood sugar under control and safeguard both her and the baby.
All right, let's look at one final case. A woman at 34 weeks who already has a history of hypertension now develops something called new onset proteinuria, which is really just a fancy way of saying there's protein in her urine. This is a classic warning sign of pre-eclampsia. So the critical question becomes, what do you do now?
This scenario really highlights a difficult medical balancing act. I mean, while immediate delivery is an option, the best path at 34 weeks is often to give her corticosteroids. This is a crucial step that helps mature the baby's lungs. And during this time, the medical team monitors both mother and baby intensely, and they're ready to deliver only if the situation gets worse. It's all about buying precious time for the baby's development.
So, after looking at all these different cases, what's the big takeaway? What's the core philosophy that ties this all together?
It really comes down to this. It's not a static checklist, it's a constantly evolving approach that uses data to prevent what can be prevented and to step in at just the right time when issues do come up.
So the 3 pillars we've really seen in action are, first, proactive screening, right? Like that universal rubella test that prevents a devastating syndrome. Second, early risk management, where something as simple as low-dose aspirin can head off a major condition like pre-eclampsia. And finally, tailored interventions. Making those critical calls on when to start insulin immediately, or when to use corticosteroids instead of jumping to an immediate delivery.
All of this leads to one final, really exciting question. We've seen how data-driven this field is, but it's constantly advancing. So as our ability to analyze data and predict risk becomes even more sophisticated, just imagine what preventative and truly personalized care will look like a decade from now. Thanks for joining us for this explainer.